Hi, and welcome to a short episode of the Chase and Care podcast. And today I'd like to spend some time looking at some of the policy insights around health and social care now that we have a new Labour government. My name's Gavin Chase, and we need to look at the critical topic of social care in England. And I'm hoping to break down some of the questions about what social care is, the challenge it faces, and discuss whether the future holds any hope for the much needed reform. Let's start off with, what is social care? So the basic question, what is social care? Social care services provide support to people living with illness, disability, or frailty. This can include help with daily tasks such as eating, dressing, and personal hygiene, as well as services like supported living, care homes, meal deliveries. The focus today is on adult social care. Children's social care is a totally different realm that also needs attention. These services are essential so that people can live as independently as possible in their own home or in a care setting. But the system that underpins the social care is buckling. It's been buckling for years under the weight of several pressing issues. So let's talk about some of those issues that have been on the table for many years. Now, this is where it gets a little bit tricky. The social care sector in England is, in fact, under immense pressure. And in March 2024, the House of Commons Public Accounts Committee gave a grim assessment. Chronic underfunding, workforce shortages, and long waiting lists are stifling the system. In fact, the Association of Directors of Adult Social Services estimates that at any given time, around 400,000 to 500,000 people are waiting for an assessment, review, or a care package. Imagine that. Nearly 500,000 people waiting to be assessed. That's right. They aren't just numbers. Let's bear that in mind. These are real people. Some are elderly, but they are left waiting in a system that cannot cope with the demand. But you need to understand what's at the core of these challenges. So dig deep. One major issue is workforce vacancies. In 2023 to 2024, there were around 131,000 unfilled social care posts. And it all starts with a high turnover rate of around 24%. But that means the industry is losing nearly a quarter of its workforce every year. Low pay? Yes, often. 0 hours contracts? Yeah, often. And a lack of full-time opportunities are pushing the care workers out of the sector. So how can you manage and maintain a high-quality service when the people providing that care that you've trained up are leaving faster than you can replace them? And the ripple effect extends far beyond the social care system. A recent report by Lord Darcy highlighted that delayed discharges from hospitals, when patients stay in hospital longer than is necessary because there's no available social care, I think we call that bed blocking in many ways, that's a major problem. Around 13% NHS hospital beds are occupied by people who frankly don't need to be there and should have been discharged. This leads to further outpatient appointments, less surgical activity, and in overburdened emergency services that are called out to people that should be in hospital. So the system's failing at both ends. And before they go to hospital. People can't leave hospital because there's no social care. And those waiting for social care can't get the support they need. So how is the sector being supported? Largely, it's through unpaid carers. Let's call it the invisible workforce. We need to understand the scale and the role of unpaid carers. In 2021, a census revealed that something like 4.7 million people in England are providing unpaid care to a loved one, often at great personal cost. Carers UK estimates that this number could be even higher. We've talked about this in other podcasts. They talk about 10.6 million unpaid care. And these carers themselves face financial difficulties and hardships of their own. Many have to give up work. Nearly 60% of them have actually got long-term health conditions themselves. And many, unfortunately, report that they feel very isolated and extremely stressed and anxious. Imagine. It's a huge burden for the unpaid workforce. And I think our system largely overlooks it. If somebody's willing to do it, we don't need to worry about it. But they're willing to do it because it's a loved one. It's not what they should be doing. They do it because it's their mum or dad or family member. Now, largely, we have to be honest and say that there have been many political promises. So, what have governments done to address these problems? Previous Conservative governments allowed local councils to raise taxes to increase social care funding. However, this hasn't solved the problem. The funding doesn't match the scale of need, and it's a patchwork solution. Under the Care Act of 2014, which was introduced by a coalition government, this was supposed to modernise social care and focus on prevention. But the House of Lords later described it as a failure. And during COVID-19, the weaknesses of the system were frankly laid bare, with over 43,000 care home residents and 1,200 social care workers dying from the virus. So let's look at the current Labour government. And they talk about a 10-year plan. With the new government in power, could things change? Prime Minister Keir Starmer has announced this 10-year plan for healthcare reform, which will shift care from hospital to communities. And he talked about integrating health and social care more effectively. Something that many governments have taught, to be fair. There's also talk of a national care service, which would standardise care across the country, and a fair pay agreement to improve paying conditions for social care workers that for a very long time, by many, are considered to be undervalued and underpaid. Probably the reason why a lot of them jump into the industry and jump out the industry back. But is that enough? Is that enough? Labour has pledged a fair pay agreement, but without increased funding for local governments. So these improvements could place a further strain on already stretched council budgets. And across the UK, there's a half a dozen local authorities which say they are effectively bankrupt. So how does that work? Labour's plan sounds promising, but many experts have pointed out that it's light on detail. For example, how will we tackle the immediate crisis of waiting lists in hospitals and staff shortages in care whilst planning for a long-term overhaul? What needs to happen next? To truly reform social care, we need more than just promises. We need sustainable, long-term funding, not short-term solutions like raising council tax. We also need to address the workforce crisis with better pay, training, and working condition. And crucially, we must recognise the value of unpaid carers by providing more support and financial relief for the millions of people filling the gaps left by our broken system. Integration with the NHS is another key factor. The health and care systems are so intertwined that problems in one inevitably affect the other. Delayed discharges from hospitals due to lack of social care highlight this interdependence. Labour's plan to move care into communities is maybe a step in the right direction, but it will require significant investment and coordination. The majority of community-based care is delivered by the private sector. And there's something like 16,000 private care provisions in the home care sector alone. So, I'm not sure if there is a conclusion, maybe more of a call to action. In summary, and most people know this, social care in England is in crisis. Still. It has been for years. Chronic underfunding, workforce shortages, and delayed discharges from hospital are just a few of the pressing issues. The Labour government's 10-year plan offers hope for change, but as always, the devil will be in the detail. After all, Boris Johnson of the Conservative Party came up with a plan and said it would fix social health and social care, but never did. For real reform, we need real commitment, real funding. Above all, an acknowledgement that social care is not a luxury. It's a necessity. And it affects people personally, day to day. Thanks for listening to this episode. Hopefully you found some of the policy insights and thought processes of value. And if you did find it of value, perhaps you'd like to subscribe, share podcast with others that are interested in shaping a better future for public services, in particular the health and social care sector, which is where the Chasing Care podcast focus. And until next time, stay informed and stay engaged. From me, Gavin Chase, have a great day.